We are live on the Get Foxy show with Dr. Shawn Soszka. Thank you so much for taking the time today to be with us.
Yeah, thank you for having me.
You are the author of a book called The Thyroid Fix: How to Reduce Fatigue, Lose Weight, and Get Your Life Back. And you're also a naturopathic physician, functional medicine practitioner, and of course, a fellow licensed acupuncturist. God
Yeah.
bless you.
Thanks. Thank you. Thank you very much.
But it's amazing how many women and, well, actually men nowadays
Sure.
too, are dealing with thyroid issues and how this is becoming such a prevalent
Mhm.
issue. So what prompted you to write this book, Dr. Shawn?
Well, I've been helping people deal with thyroid issues for about 20 years now, and really, I wanted to share my knowledge. I've found so many times people are underdiagnosed or misdiagnosed, and because of that, just I feel like this needs to get out to everybody who's possibly dealing with a thyroid issue. I mean, there's a lot of folks out there that've got a lot of problems, and thyroid may be the source of that.
Now, when we talk about thyroid problems, how do those problems show up? I mean, as healthcare practitioners, you and I have an idea, but
Yeah,
a lot of my listeners may not. So what
fair
does it
enough.
look like when you have a thyroid dysfunction?
Well, one of the biggest things, of course, is the fatigue part of things, that just feeling tired, the capacity to get things done and live your life with quality is just lacking. For lack of better description, the get up and go is gone. So that's one of the big things. But I mean, of course, fatigue can mean so many things and can be so many different causes. With thyroid, we see fatigue, we see the difficulty in losing weight, often like low libido is a common theme. And for women especially, and true for men as well, is the hormones are oftentimes out of whack. And what should say, really, I should back up and say that with thyroid affects every single cell in the body except for red blood cells. So that means brain cells, digestion, skin, hair, fingernails for that matter. So all of these cells are being impacted and are working at well, lower than optimal level, and therefore you name the system, you have the potentiality of seeing symptoms there. But fatigue is usually the big one.
And that seems to be a very big complaint, especially with a lot of my listeners. You
Hmm.
know, they tend to be women somewhere between 30 and, well, 60.
Yeah.
And, they have a hard time finding enough energy in their lives to be the entrepreneurs, to be the mothers, to
Hmm.
be the wives, to be the partners, to run their businesses, to, cart kids from here to there. And,
Absolutely.
I've had patients who've described their energy like spoons. They said, when I wake up in the morning, I'm handed 5 spoons.
Yes.
And then, when I do this task, then I give away 1 spoon. And
Hmm.
then when I do this task, I give away another spoon. And then I'm only left, with 3 spoons left. So if I've got 4 more or 5 more tasks during the day, all of a sudden I'm wiped out.
And I hear pretty much the same thing. I mean, I'd say that a majority of my thyroid patients are women of that same age group. And it's especially true. I mean, this lack of energy. And the sad part is that they've often gone from doctor to doctor, and the thyroid is often just overlooked or just missed entirely. And so I think that's a really important thing. So if any person who has fatigue and that, those 5 allotted spoons, as it were, of energy, this is something they really need to look at. It's pretty important.
Now, why do you think the thyroid is so overlooked?
Well, I think a lot of times is because most conventional practitioners do a very limited set of tests. And made even worse is the fact, and this particular test is called TSH, thyroid stimulating hormone. The parameters for quote unquote normal testing is far exceeds what has actually been recognized as appropriate. So, I mean, if you did this test in Europe as an example, they would say, oh, no, you're way out of whack. You're definitely hypothyroid. In the US, they would say, no, you're fine. So there's like this discrepancy even in the lab itself, and the lab itself is limited as well in terms of its use. So a much more expanded approach is useful. And just to add a little more to that, I would say that a lot of these people with thyroid issues, especially a lot of these women with thyroid issues, have autoimmune thyroid. So their immune system is attacking their thyroid, and that's the big issue. And that is often never tested, and that's massive.
That's huge. That's really huge. So we're talking, it sounds like we're talking more about hypothyroidism as opposed to hyperthyroid.
Right. Hyper, I mean, it's not as common. I do see patients with that, of course, and that's more, there could be fatigue with that, but that's more the weight loss, eyes become enlarged, anxiety, heart pounding through their chest. And to kind of add to that for a minute, there is an unlucky few who have, when they have what's called Hashimoto's, which is the term used for autoimmune thyroid, where they have both. And my first patient, when I was way back in 2000, when I was a young whippersnapper, young doctor, and she came in, and she had had her fourth child. She was in her early 30s. Interestingly enough, she had grown up in the Ukraine. So if you're thinking Chernobyl, you'd be spot on. So that was probably a cause for her. But she was going from like lethargic, where she couldn't get off the couch to function, to the point where she thought her heart was going to rip out of her chest because of all this, this hyperthyroid. So she's going back and forth. And so that's always a possibility. It was not a pretty picture, but for the most part, we're talking more the low functioning thyroid is really the big thing that is, again, overlooked, oftentimes thought of as strictly a depression issue. And again, if it's thyroid, you can take as many depression medications as you want. You're not going to see the results you should be getting.
That's something I know my own mother has dealt with, some hypothyroid issues. And the doctors that she would go to pretty much told her, yeah, it's all in your head. That's
right. It's not, it's in the neck.
So yeah, unfortunately, it was very frustrating for her to have to go through that and say, well, no, I'm not crazy.
Right. And what an insult to anybody who hears that. Because, I mean, again, what's the neck attached to? I mean, what's the head attached to? It's attached to the neck, it's attached to the body. So, I mean, it's all interplaying. And of course, Chinese medicine practitioners, we don't even think about that separation that Western medicine has. We totally think integration, and that's really key.
Yes, indeed. And for our listeners who don't know where the thyroid is actually located, it is up in the neck and throat area. What inspired you, Dr. Shawn, to start specializing in this thyroid work?
Well, it was really that first patient I just mentioned, that one that was having that horrible situation. And I just started studying quite extensively. And I think as you kind of are presented this, and the universe just sort of provides these patients. And so I kept on getting these patient populations with thyroid issue. And plus, so many people have that it was just almost inevitable. And of course, I actually have, I also specialize in digestive disorders, and I've taught gastroenterology for that matter. So you have more of a holistic perspective, and certainly thyroid does seem to come up quite a bit. And so it is, I think, sheer numbers and the fact that I've been paying attention and seeing these issues arise, and it ends up being thyroid. It's been the theme.
It's kind of funny how we as practitioners are drawn to specific areas of treatment. And I do believe, this is my own personal belief, that we're kind of put on this planet to serve in a specific capacity.
I agree.
So for me, it's kind of, I didn't get into acupuncture school planning on specializing in aesthetic and facial acupuncture. That wasn't even on my radar. but I
Sure.
got into the work because I wanted to serve my mother with all of her autoimmune issues.
Mm-hmm. Mm-hmm.
And then the more I started delving into things and the more I started learning, all of a sudden here I am working with Bell's palsy and trigeminal
Right.
neuralgia, and then also
Right.
doing the aesthetic and
Mm-hmm.
beautifying type work.
Sure. Absolutely.
And
And yeah,
yeah, go ahead.
and acupuncture is so great for autoimmune conditions. I mean, I use it all the time. It's a fantastic therapy, and talk about a lot of results for little effort. I mean, I think so many people are used to in the Western world having to go through these heroic efforts, heaven forbid, like Botox, for goodness sakes. But the acupuncture can to get such great results was, that you're laying down for 30 minutes, you're getting acupuncture, you're relaxed, you feel great, and you're getting better. I mean,
You bet. But here's a question that I
yeah.
ask all of my guests, Dr.
Mhm.
Shawn.
Sure.
What does Foxy and being Foxy mean to you?
The way I think about that, I think of that as being able to live at your optimal capacity, the ability to live your dreams and to really manifest your purpose in the world. So in essence, it's that operating at maximum ability to live your life, to live a life of quality, and to really fulfill your dreams. I think that's really fundamental, and that full of energy, full of vitality, full of happiness, for goodness sakes. All of those things, I think, is the foundation for, if you want to talk about Foxy, I think that's it right there.
Amen. And who in your opinion embodies foxiness in your world?
I should say, in all fairness, my wife. And I do mean that truly.
Yeah, you
And
got the points in.
well, no, I mean, truly, I think I would say so. I mean, really, I think of a number of people I've encountered, especially in the thyroid world. I don't know if you've ever heard of Isabella Wentz. She's a thyroid expert as well. I had the pleasure of meeting her, and she's truly a person. She is a pharmacist, and she's had thyroid issues, and she's overcome her thyroid issues. And to me, that really kind of captures. And I met her and her husband at a conference. Wonderful people, and she has that vivacious energy. She's living her life to her fullest. Just had a baby. I mean, really living a quality life, and she was in bad shape when she first went on her journey for thyroid issues. And so she's kind of like a fellow thyroid advocate and traveler, if you will. And so she really kind of captures, I think, that in a lot of ways. And there's got a couple of good examples there.
How did you end up getting into the healing profession?
Right. Well, I think I was always drawn to that. As far back as I remember, I certainly had an interest in how the body operated and health itself. Unfortunately, I actually had a lot of health issues growing up. What turned out to be an undiagnosed milk allergy had me as a frequent flyer in the pediatrician's office with ear infections. And, I pretty much lived on antibiotics for the first 5 years of my life, which, of course, brought its own issues long term. But certainly that whole episode, or the series of episodes of illness, really kind of got me focused on health. And it was later on when I discovered, oh, it was a milk allergy. It was that simple. That's what turned me towards the alternative medicine world as opposed to conventional, for sure. And so certainly, and also other family health issues kind of drove me to find solutions and answers. And certainly the naturopathic world and the Chinese medicine world were my natural domains. And of course, I grew up in the San Francisco Bay Area, so I was exposed a lot to a lot of Asian culture. And my favorite place to go when I was a wee fellow was this Chinese herbal shop, and loved to look at all the herbs. And I'm sure the fellow who gave me those little rice candies with the cat wrappers, I'm sure that didn't hurt matters either. He was probably sowing the seeds, whether he realized it or not. But yeah, so that's kind of my background in terms of, I've had my own health issues, not thyroid itself specifically, but other factors. But I've come to appreciate that which is commonly overlooked. And for me, that's translated into addressing thyroid. But of course, see a lot of other factors as well. But really, that's the key element for me, is that things get overlooked. And sometimes there are simple solutions, sometimes there's complex solutions. But again, overlooked is the thing I see so common in conventional medicine.
Yeah, milk allergy, you would think would be something that would come up fairly obviously, but yeah, in our day and age,
Yeah,
it
yeah.
certainly isn't. Now, are there dietary issues like with this milk allergy? Are there dietary issues that someone with thyroid problems should be aware of?
Well, one of the biggies is actually gluten. And so that would be specific to wheat, rye, and barley. And gluten is certainly has entered the public consciousness as a concern. And why that's relevant, and this is really more specific to if someone has an autoimmune thyroid condition. And I should back up and say that if a person has hypothyroidism, 95% chance they have the autoimmune piece. So pretty relevant. And why gluten comes up is because the proteins found on the surface of gluten can mimic the proteins found in the thyroid cell itself. So if the immune system is reacting to gluten like it reacted to milk for me, it could certainly set off a cascade of reactions where the immune system starts attacking the thyroid, saying, "Oh, you look like gluten, attack." So gluten's a big one. If there was any food that anybody took out of their diet, that would probably be a massive one.
That's something I just recently had to start doing myself on advice from a classical homeopath. Actually, her name's Amber Curry. She was on the show a few episodes back. And she suggested, yeah, maybe you got to go off on gluten. And I went, oh, no.
Right.
I'm a big beer drinker.
Oh, right.
A big
Fair enough. Well, here in Portland, Oregon, we're kind of the gluten-free mecca. And there's actually, I believe, 3 gluten-free breweries here.
I may have to go and take a trip, because where we're at here in northern Colorado, it is definitely the Napa Valley of beer.
Oh, right.
But unfortunately, there is not the gluten-free brewers out here that there are in your area. So I might have to take a trip out there.
Fair enough.
But yes, so ladies, if you're listening and you've found that you might be dealing with thyroid issues, or you're feeling that fatigue, definitely look into Dr. Shawn's book, because this might give you some insights in how to improve your energy and start taking control of your health.
Yeah, you can really turn things around. I mean, I've seen some remarkable things. Matter of fact, this morning, seeing patients, I saw 2 patients with thyroid issues, because that's 90% of my practice. And it's amazing how things really pick up. And they're like, oh yeah, it was great. I've been hiking. I've been doing all these things. I finally taken up this hobby that I've been thinking about, but I've been just getting home from work and crashing on my couch. And just seeing the light come back in their eyes is such a reward as a practitioner. I mean, it's so fundamental.
What's one of the most outstanding transformations that you've seen in your patients?
Well, I mean, probably one was a patient who she experienced such profound fatigue, she really wasn't able to work. And so over time, we got her system completely overhauled: thyroid, digestive issues, brain fog's a big one, that short-term memory issue. And the fact that she was able to return back to work, restart her career, was massive. And so it was really profoundly rewarding to see her, just contribute to, her profession and to the world. And just to see her so happy, and her relationship improved because she was no longer tired or not being able to do this or that, and so much changed for her. And that's not the exception. I mean, that's very common to see that whole scenario take place. It's why I'm such an advocate for figuring this out. And if it's not the thyroid, that's fine, but you should really investigate to make sure. It's really,
You bet. Well, that's profound and absolutely life-changing. I mean, I can't imagine the impact that your work had on her life. I mean, that's improving somebody's quality of life. And right
absolutely.
there, I mean, that's high five, doctor. You did
Yeah.
mission accomplished.
Yeah, yeah. Yeah, and it is not a difficult process. It's just knowing what to look for and actually doing the appropriate testing and paying attention. And of course, listening. That's a big thing. I think so many patients, and maybe you hear this too, where uh, a lot of practitioners just like zip them in, zip them out. It's like 5 minutes, you get a chance to say something, and they might look up from their clipboard or tablet, and hopefully there's something there. But the process of listening is so fundamental to healing.
Besides picking up your book, what would you say would be the number one thing someone should do in order to keep their thyroid in good functioning condition?
Well, I would think probably selenium, of terms of a mineral, is probably the most relevant, and the highest selenium-containing foods is Brazil nuts by far. And why I say selenium is because it actually helps uh, in autoimmune thyroid conditions. It also helps in what's called the thyroid conversion process, where the inactive T4 converts to T3, and that's where the rubber meets the road, and that's where the energy comes from. So if conversion is an issue, selenium is oftentimes the most useful thing. So.
Uh-huh. And selenium, this is a supplement that you can pick up fairly easily.
Yeah, yeah, it's readily available. And again, Brazil nuts it's a pretty safe amount. You can of course take too much selenium, but Brazil nuts do it's important, certainly. I mean, there's much more to it, of course. And if a quick second would be my, recommend B complex is a big game changer, because a lot of people are deficient in Bs, and that's, I think, pretty relevant as well.
Okay.
And then of course, quality sleep. Quality sleep, of course, that's not new news, I think, for anyone, but very relevant.
Yes, totally. And that's something that really I believe women need more sleep than men. And I can't remember. Shoot, now I'm spacing the study where I'd read that, but it's something that I definitely put into practice in my home and allow my wife to sleep in as much as she possibly can. And I'll tell
Yeah,
you what, it makes a difference.
sure, absolutely. And certainly I've seen a lot of times women do sacrifice their own health for the good of their family and their kids. And that's oftentimes a big part of healing, is like, okay, no, you need to take time for yourself.
Yes.
It's really huge.
Yeah, that's something that I see a fair amount in my office as well. Women just giving and giving and giving and giving, yet not taking the time for self-care.
Yeah.
And of course, that's Chinese medicine. We talk about that yin-yang balance. We're constantly
Mm-hmm.
in that yang state.
Yeah.
Uh, we need we need that yin. We need that self-care. We need that quiet time. We need to nurture ourselves in order to have that balance and be healthy human beings.
Absolutely. I mean, it's fundamental, and that whole lifestyle is a big piece of it too. The quality of sleep, the relaxation, the ability for self time and downtime. So spa days. That's the call to order. Spa days. Lots
There
of
you
spa
go.
days.
You heard it, ladies. Doctor's orders, spa days. Well, Dr. Shawn, how can people get more information about you and your book?
Well, certainly my book is on Amazon, and of course on my webpage, and that's drsoszka.com. And certainly I've been working on launching my YouTube channel. That's a work in progress, and that's going to be happening fairly soon as well.
Excellent. I will get all those links from you. We'll put those in the show notes. So you can just go to thegetfoxyshow.com and Dr. Shawn's episode. You'll find all those links on the episode page. Well, Dr. Shawn, we are up on time already. I
Wow.
have had an absolute blast getting to chat with you today.
Likewise, likewise.
Time.
Thank you.